Is exercise like strength training supposed to hurt? This video is going to cover what you can expect or what you may experience in terms of discomfort while doing exercise, with more of a focus on strength training, including what's normal and what instead may indicate an injury. I'm Dr. Elise Brown, and I'm a scientist who studies how exercise helps to prevent and slow the progression of diabetes. If you're new to exercise, especially strength training, you may not be familiar with different sensations in the body that normally happen during and after exercise. It's important to know what to expect so that you can better distinguish between discomfort that's typical versus discomfort that indicates something might not be quite right. Let's start with muscle pain. If you're feeling a burning sensation in your muscle during exercise, this is likely lactic acid. It is produced in higher levels in the body whenever we exercise at higher intensities that typically last between 45 seconds to 2 minutes. More lactic acid is produced whenever we do muscle building types of exercise. And strength training, this typically happens whenever we do rep ranges of 10 or more. After exercise, lactic acid levels return to pre-exercise levels, meaning a normal range, typically within 30 to 60 minutes after exercise. So if you're experiencing muscle soreness a day or two after exercise, that's not lactic acid. It's delayed onset muscle soreness, or DOMS. It's caused by exercise that you're not used to, or eccentric contractions, which is the muscle lengthening phase of an exercise, like the lowering of a bicep curl. The soreness is thought to be caused by micro tears within the muscle that happen during exercise. And while you're resting, this is when your body is healing those micro tears and restructuring. The most intense symptoms typically occur between 48 to 72 hours after exercise. If you're experiencing DOMS, you'll likely also notice a decreased range of motion, swelling, and weakness in the main joints and muscle groups trained in that exercise session. This is all part of the normal healing and remodeling process. These symptoms are going to be more intense with your first workout, but your body's going to adapt and you're going to experience a lower level of muscle soreness and muscle damage in future workouts. This is called the repeated bout effect, and it's been shown to last anywhere from several weeks up to 6 months. Now, if the eccentric contraction during exercise is extreme, this can result in an injury like muscle strain or tendon injuries. You can expect that this may have happened if you experience a sudden sharp pain while exercising and it gets worse with movement. This situation is likely some type of injury and not normal sensations that you would experience if you're exercising safely. You may also notice swelling, bruising, and difficulty using that part of the body. If this happens, you may need to seek medical attention.